Hi, everyone. Thank you so much for tuning in today. I am extremely excited to welcome back Dr. Aaron Boster. Most of you probably know who he is. If you don't, you absolutely need to. He is a board certified neurologist who has dedicated his career to helping people with multiple sclerosis live their best lives. He's the founder of the Boster Center for Multiple Sclerosis, a clinical researcher, and a passionate educator who reaches over 80,000 people through his YouTube channel. He's one of my favorite MS neurologists and is able to break down difficult concepts into easy, tangible advice that anyone can understand and apply. On today's episode, Dr. Boster is sharing his powerful 5 for 5 framework, which are 5 essential strategies to help slow MS progression and improve quality of life. Dr. Boster, thank you so much for being here with us today.
Thank you for having me back. I love being here.
I am so excited. I feel like we always have the best conversations, and I love how easily you're able to share information so that everyone understands, especially because MS can be complicated. So thanks for being here.
Oh, it's my honor. I think we share an opinion that if you can help someone understand why we're asking them to do something, they become a partner in care with us. And that's really where we want to be. So opportunities like this are fantastic.
Absolutely. And one thing that, well, I'll say the main thing that we're talking about today is something that I've heard you call your 5 for 5. And I'm
Yes.
so excited for this topic because managing MS can feel like a huge burden. And there's just so many different possibilities and ways to manage MS. And if it's a lot, but you seem to break it down and make it feel really manageable, which I really love.
Thank you. I think I've been doing this now for like 2 decades, which is amazing because I feel like I'm 19. But in this journey, as I try to help families live their best life, despite having MS or try to make the MS as boring as possible, I think it's critical to help them have a framework for what it is we're trying to do. And to your point, it can be really, really overwhelming. And so I try to condense it down into bite-sized pieces, which can be easily absorbed. And in my clinic, we really fall in this concept of being 5 for 5 in your fight against MS. And I share with families, there's 5 things that I'm aware of that will slow the disease down. And so then I systematically go through all 5 with them. And so maybe we'll do that today and kind of talk through it.
Yeah, absolutely. Let's dive in. So, and also, actually, before we go into the 1 through 5, is there an order that you should, like, is number one what you should focus on first, or are they all equal in terms of what to prioritize?
I think everyone comes to this disease in different places. And so I sort of want to meet you where you are. And they're all works in progress. And so sometimes I'll meet someone, like I did a consultation today, and the guy was 4 for 5 off the bat. So we're going to focus on the 5th one. So I wouldn't suggest like it's hierarchical.
Mhm.
It's intended more to be a bit flexible so that we can kind of meet you where you are and then we can kind of grow together.
I like that. That makes it feel even more accessible.
Woo!
So, what what is your first one?
Don't smoke. So I share with people that smoking is the very best way of speeding up MS. And it's shocking that smoking doubles an individual's risk to develop MS. And if you have MS and you smoke, you can speed up the disease by 50%, which is really, really striking. Not lighting carbon-based stuff on fire and then breathing in the smoke is really important. And that applies to both tobacco and to cannabis in this modern era. And I don't feel like it's my right to tell someone paternalistically they're not allowed to smoke. I feel instead that it's my like ethical and medical responsibility to educate them about this fact and then to support them and help them if they're in the process of trying to quit. And really beyond smoking is a much bigger discussion about any cardiovascular risk factor. And so if someone develops diabetes or they're morbidly obese or they have really high cholesterol or any other cardiovascular risk factor, hypertension, we must address that because essentially they're going to make the arteries of the brain get harder faster. They're going to make the brain shrink faster. They're going to diminish our opportunities for neuroplasticity, and they're going to create this inflammatory milieu in the brain, which is ultimately going to contribute to making them worse quicker. And there's actually really solid data that if you quit smoking and you control cardiovascular risk factors, you can slow the disease down. So number one is to not smoke.
Wow. And so that would be CBD, THC is excluded from that?
I don't want you to take anything carbon based, light it on fire, and then suck in the smoke. And that applies to tobacco, like a cigarette.
Yep.
It also applies to cannabis. Now, we've talked to you and I before about how I'm a big proponent of using cannabis medically for certain MS symptoms, but I don't recommend smoking it. I would much rather that you use it topically or that you use an edible as a better way. And if we need a faster onset of action, tincture is a much better option than a blunt or a joint or even vaping for that matter.
Awesome. Yeah. And if you're listening and you are a Missing Link member, we had Dr. Boster, I believe it was in December of this past year, and our whole topic was CBD. So definitely check out that recording. Okay. So no smoking. Got it. What is number two?
Exercise is part of your lifestyle. And so this is no unusual framework for the people that you and I run around with. And really, it can't be stressed enough. Now, when I say exercise is part of your lifestyle has a very specific meaning to me. So when you do something as part of your lifestyle, in my mind, you're not rewarded when you do it and you're not punished when you don't do it. It's just part of your life. And I'll use the example that I have a lifestyle of showering in the morning. You're welcome. And if for some reason I couldn't get my shower in, I would just do it after work, let's say. And I think oftentimes we have this all or none mentality. And many of us, when we think about the glory days of, say, high school or early college, and we think that's the only way that we can exercise, it's setting us up for failure. And what I'm looking for, particularly early on, is I'm looking for presenteeism. I joke, if you put your Lululemon on, you get your sneakers on, and you step out the door, I'm giving you full credit that day. And I want to get someone in the habit of visiting an exercise environment on a regular basis. We may start off with exercising for 5 minutes twice a week, and then we're slowly going to normalize exercise as part of the lifestyle. Exercising is arguably the most important and least appreciated disease-modifying therapy to slow this disease down, to keep people ambulating, to maintain cognition, to treat depression, to improve sexual function. I mean, I go on for a little while. It's pretty important.
Yeah. I love how you break it down too, because I think so many people think of exercise as this big thing, especially if it's been a while since they've exercised. In their minds, exercise means going to the gym for an hour. And if you can't do that, it just feels like it's not accessible to you. But as you mentioned, it could be a few minutes twice a day.
Absolutely. You've taught me a lot, and your book has taught me a lot. And I invoked your name several times in clinic today. I was talking to a nice lady, and she said, I just can't get to the pool the way that I want. And, I'm having trouble getting to the jazzercise class, and I just want to walk better. And so I said, well, my friend Dr. Hawley said that the best tool for walking is to walk. And so we had an entire discussion about how walking a lap around her cul-de-sac was probably going to be the biggest bang for her buck. And it was so exciting to watch her face light up like, aha. So that was really, really awesome.
I love that. That's awesome. Very cool. So obviously I'm a huge advocate for that one. What is number three in your 5 for 5?
Number 3 is eating smart. And this is a really big topic. And it's kind of a charged topic because there's a lot of opinions about this. And I tell people, if you are bored and you're in a mall, walk into the mall bookstore and say, I have MS, and watch them get all animated and rush you over and show you all these books that were written by people that have initials after their last names like we do. And I tell people there's no diet that has been proven necessarily to slow the disease down. But I hate it when doctors, particularly allopaths, say something silly like, it doesn't matter what you eat, because it absolutely does matter what you eat, particularly as it relates to management of energy levels, management of mood, and then just body mechanics. So I start off easy breezy cover girl. I want people to up their water game, and I want them to supplement vitamin D. And so really I'm shooting for a minimum entry level of like 64 ounces of water a day, upwards of like 80 to 100. And that is an arduous task for a lot of, red-blooded Americans. So I'll tell people, look, We're not going to start off doing that. I say, however many meals a day you eat, whether that be 1, 2, or 3, I want a glass of water with the meal. And I tell them, you pick the size of the glass because I'm going to trick you. I'm going to get you used to having a glass of water with your meal, and then we'll make the size bigger later. So we do a glass of water with each meal. And then very simply, we do 1 glass of water between each meal. And if that's a 20-ounce glass, you're there. And so we really work towards that goal. And time again, I am blown away by how much better we can manage bowel, bladder, spasticity, fatigue when we're hydrated. And so that's where I start. I think that the data, and it's associative data, but the data that lower levels of vitamin D seem to track with worse disease outcomes, and that higher levels of vitamin D seem to track with better disease outcomes is legit. And, I practice in the Midwestern United States where there's not a lot of sun a lot of the year. And so a lot of vitamin D levels are really, really low. And so we try to push that vitamin D 25 OH level above 50 and below 100. That's like the sweet spot. And, if you went out in full sun, naked for 15 minutes, you'd absorb 5,000 international units and you get frostbite and your neighbors would call the police. And so that's not really realistic in many lives. There are foods that have high in vitamin D, but you would have to eat like an entire salmon, like the whole fish, like once a day, which is not realistic. And so the vast majority of my patients supplement vitamin D with a pill or a liquid. That's where we start. And then it actually kind of gets hard. And so we certainly don't kick the disease off this way, but the next step is really to get into food quality. Now, if you look at all the different varied diets in MS, the Walls Protocol and Overcoming MS and the Swank diet, and you go on and on and on, the one common thread is high food quality. So I try to educate families about ultra-processed foods because some people don't know what an ultra-processed food is, how to identify it, and how to start to make directed choices at eliminating some of the ultra-processed foods. So I tell people, I don't want you to eat fast food, fried foods, sugar-laden foods. I don't want you to eat foods that have ingredients that you can't pronounce, because it's my contention that by 2nd grade, you know all the food words, like chicken and broccoli. Those are all the food words. And if it's got a long strand of letters that you can't pronounce, that's not a food, that's a chemical, and I don't want you to eat that. So number 3 is really learning to eat smart, and that's a journey that we go on with people.
I like that journey starts with water intake, because that's something that's accessible to anyone and it doesn't cost anything. However, as we're all well aware, incontinence and urinary urgency and frequency can be a primary symptom for lots of people.
Yep.
Are there any tricks of the trade to make sure you get your water intake without worsening those symptoms?
100%. And a lot of people who have overactive bladder, so they have symptoms of, oh my God, I got to pee right now. So they have urgency, or they have frequency. They just got back from peeing and they got to go again. Or they have nocturia, where they're waking up multiple times a night to pee, or they have frank incontinence. The knee-jerk reaction is to not drink water. All right, it's to dehydrate yourself, because then they think, okay, well, if I don't drink water, I won't make urine. But it's actually not true. You still, as long as you have blood volume, you'll make urine. The problem, if you're dehydrated, is that you make ultra concentrated urine. So when you pee, it'll be like really, really dark in color. And that ultra concentrated urine has a lot of like metabolites and essentially like, toxic waste products, which irritate the heck out of the bladder wall, causes the bladder to spasm. It can cause it to stay contracted, and it's going to make a lot of those urinary symptoms worse. And it's an awesome environment for bacteria to thrive. Mm-hmm. If, on the other hand, you're hydrating, you're constantly flushing the bladder, you're constantly diluting the metabolites, and you're constantly washing out the bacteria, and you fare a lot better. And your point's well taken. Well, what if you have to pee all the time? So one of the tricks of the trade to help people not wet the bed, God forbid, or to wake up 8 times to pee in the middle of the night is I want you to drink 2/3 of all the water you're going to drink in the first half of your day. And then I want you to put the kibosh on fluids after dinner. Now, most of us do the exact opposite. We may drink a little coffee and then like not drink water all day long. And then after dinner, we're really parched. And so we start pounding water and we take water to the bedside table. And then we wonder why we get up several times to pee. If you drink water with breakfast, water after breakfast, water with lunch, water after lunch, and then water with dinner, you're not going to be thirsty in the evening. And I like to remind families that when you consume water or liquids, you're going to make urine for 6 hours. So if you're taking a glass of water to the bedside table at 10, 11, 12, 1, 2, 3, you're going to make urine until 4 a.m. And that's really disruptive. I also remind people that another thing that I want you to do for your health and for spasticity is to get up and move. So if you're drinking water during the day, that sort of necessitates that you make your way to the bathroom. And so there's an added extra bonus to that.
That's sneaky. I like it. And to speak a bit more on vitamin D as well, I believe one of the most recent studies that I've seen circulating lately, I think it was maybe in March of this year,
Mhm.
was about vitamin D and the possibility of it delaying progression or slowing down disease activity. Is that something that you've seen with and agree, or not so much?
The data on vitamin D has been argued amongst MS nerds since I was in training. And when I look at the totality of the data, two things are clear in my mind. One is that it's safe. So vitamin D levels under like 125 are really safe. Now, here's the medical disclaimer. You have to talk to your clinician about what's right for you. I'm not giving you medical advice, all that stuff. Right? But ostensibly, like it's not dangerous to supplement vitamin D below those levels. So that's the first thing. And I think that the data supports that. The second thing is when you look at groups that have lower vitamin D, they have more attacks and more new spots on MRI. And when you look at groups that have higher vitamin D, they have less attacks and less spots on MRI. There are some papers that suggest it might slow progression or might improve cognition. And I think some of that data is contested, but the direction is all in favor of supplementation. So that's what I go with.
I like that. So let's wrap that one up and move on to number 4.
So number 4 is kind of a crunchy, touchy-feely hippie one. And I didn't used to have it in the mix. In fact, I used to call it 4 for 4. And a good friend of mine who is an expert PhD psychologist who focuses her entire career on MS called me one day and she said, "Hey, Boster, you forgot one." I said, "No, I didn't. I made it up." And she said, No, you forgot mindfulness." And she was right. I forgot mindfulness. So number 4 in being 5 for 5 is to practice mindfulness daily. So I'm old enough that I wasn't taught anything about mindfulness in school. And nowadays they actually educate children in American school systems about mindfulness, which is amazing. I define it as being in the present moment without prejudice, meaning you're involved in an activity and you're not simultaneously worried about what happened yesterday. You're involved in an activity and you're not worried about what's going to happen tomorrow. You're just focused on the activity. So I joke, if you're having sex and you're thinking about work, you're doing it wrong. And the reason that this is so important, there is data that stress worsens MS, which is a really big issue because lives are stressful. And I hate it when doctors say silly stuff like, "Remove the stress, honey," as if like you could cut the stress out, which is not possible. However, learning to manage stress is a life skill, which frankly, a lot of us aren't taught. And so practicing mindfulness for 5 to 10 minutes every day is a way of cultivating behaviors to help you manage stress. And I'll use an example. I shared earlier that I have a lifestyle of showering every morning. During the pandemic, I started to do something which I still do religiously every morning. When I finish my shower, I sit down on the floor of the shower with the water running. You can throw stones at me. And I close my eyes and I do a breathing exercise that takes me about 7 to 10 minutes. And it's a pause in my morning, which is slowing me down and it's centering me. And it's arguably like one of the best parts of my day. I've grown to love it. And I actually will wake up a little bit earlier just to make sure that I have time to do it. Now, I don't suggest that everyone in their chicken like sit in their shower when they're trying to get ready for work, but that's an example of being mindful. And you can turn any activity mindful. Exercising for many people can be mindful, particularly if you're really focusing on what you're supposed to be doing. Yoga is a mindful activity. Meditation is a mindful activity. Bible study can be a mindful activity. Going for a walk in the woods is a mindful activity. You can have a mindful meal just by turning off all the peripherals and really taking a second to appreciate the food that was made for you and the people that you get to be with and those kind of things. So number 4 is the daily practice of mindfulness.
I really like that. It's reminding me of something I believe it was my mom at one point told me. To be mindful was to try to feel the seat that you're sitting on.
Yeah.
Or if you're standing, can you feel the floor underneath you? And just bringing your awareness to sensation can be one way, one of many, to kind of take you out of your thoughts.
Your mom is smart.
Awesome. Okay. And then number 5, what's the big one?
So number 5 is to take the most effective disease modifying therapy that you're comfortable taking and make sure that it's working. Now, that's a sentence that I've crafted very carefully over years and years. So I want to break it down.
Yeah.
I want you on the most effective DMT because of the 28 different formulations of FDA approved disease modifying therapies. They're not all equal in efficacy. They don't all have the same oomph. Some of them are not very good at slowing relapses or slowing disability. Some of them can't slow disability. Some of them don't do a very good job of slowing brain volume. Some of them do a great job of that. And so, given that they're not all equal, I want you on the most effective one that you're comfortable taking. So that's the second part, because I'm not in charge of you. All right. So it's not my right to inform you of your risk benefit or risk aversion. It's my obligation to educate you on the good, the bad, the ugly, and then to help you become comfortable. And so, for example, Copaxone, glutaric acetate, is very low efficacy medicine, but it's also really, really safe. And I have some patients that's the only thing they're comfortable taking. Okay. But I want you on the most effective drug that you're comfortable taking. And then I want to make sure that it's working. And I remind families, we don't marry drugs, we date them. And as long as the drug is a gentleman and he treats you nice and he's nice to your family and he's a good dancer, well, then that's a great relationship. But if he starts to misbehave and comes home smelling like alcohol or with, lipstick on his collar or what have you, well, then we're going to take him out of your phone and we're going to remove him off Facebook and we're going to tell him that you're going through some things and you need some space. And then we're not going to call him back. Because the goal of the disease modifying therapy is to prevent new brain damage. It's to prevent new disability. And I remind people, if you were on birth control and got knocked up, it didn't work. That's not the goal of birth control. And so I want you on the most effective drug that you're comfortable with. And then working together as a team, we're going to make sure it's working. We're going to make sure that you're winning the litmus test of life and that you're not having new attacks. We're going to get annual MRIs and make sure that we don't have new evidence of brain or spinal cord damage on imaging. We're going to make sure that your exam is not changing. We're going to make sure that your brain volume rates are normalized. And so that's the 5th one in 5 for 5.
I love that. And it makes me think, so as we age, would it still be 5 for 5? Or at some point when people are at 55, 60, 65, does that 5th one go away?
No, absolutely not. So I think that there's a massive issue. There's almost like a disease among some MS neurologists called ageism, where they've started to develop this nonsensical idea that just because you celebrated a certain birthday, well, honey, you're fine. You don't need medicine anymore. And I vehemently disagree with that. So we could have a whole discussion about that and how that's wrong. And I think there's plenty of data to support that. It's wrong. What I'll tell you instead is that I think that the risk benefit of a medicine can change with time. And as we age, something that might have been safe 20 years ago might not be as safe now. And so, whereas I disagree with stopping a medicine because you celebrated a birthday, I do oftentimes do something called de-escalation, where we might take you from a really ultra high efficacy medicine with a side effect profile, which is no longer favorable, and switch you to something else, which is better tolerated and safer. And that's a maneuver that I feel very comfortable with.
I love this 5 for 5 approach because, again, it's very accessible, but it also encompasses so many different, I don't even know what to call it, because it's nutrition, but it's also mindset and it's medication.
There's a stage in acceptance of MS where someone says, am I doing all the stuff I need to be doing?
Right.
And my answer is, are you doing 5 things? So there isn't 6, there isn't 4. There used to be 4. It's just a way of getting your head on straight. Now, the other things that obviously we need to be doing is we need to be good partners in our own care. And we need to be forthcoming about, hey, I can't feel my leg. Hey, I'm seeing double, I'm not able to sleep at night. I mean, and that's a constant give and take, trying to optimize symptoms and become aware of attacks and treating them. But if you can not smoke stuff, if you can exercise as part of your lifestyle, if you can learn to eat smart, if you can practice daily mindfulness, and you can make sure that you're on the most effective disease modifying therapy that you're comfortable taking and make sure that it's working, we are well on our way to making this disease boring and helping you live your very best life.
I love that so much. Thank you so much for sharing that. And it sounds like maybe a sneaky one that would be included in all of those could be communication with your healthcare provider, with your neurologist, with
Amen.
your spouse, anyone.
You're a you expert. I mean, you know more about you than any MRI or the MS Olympics or any someone else in your life, even someone else who's intimate in your life. You're the you expert. And so it's imperative that you are active in your care. And just because you and I read books that they didn't read, it doesn't make us smarter. It doesn't make us better. It just means that we read books they didn't read. And then they bring their expertise of their body to the table. And then we bring the stuff that we learned. And then we're a team. And so that teamwork does not work without communication. It doesn't work at all.
Right. Where can people find you when they listen to this episode and they're like, oh my gosh, I need more Dr. Boster in my life?
So I hang out on social media quite a bit. I have a YouTube channel, which is my name, Aaron Boster, MD. You can check out our website at the Boster Center for MS, which is Boster. It's a bosterms.com. So not too hard to find. So if you see me online, wave and say hi.
Awesome. And we'll put those links down in the show notes as well. But thank you so much for chatting with us today, sharing your expertise, and just really breaking it down and making management feel more accessible and manageable.
Thank you for having me. It was an awesome time to talk. Take care.